Question number 705. An important nursing intervention during the fourth stage of labor is to Option A. Vigorously massage the fundus. Option B. Monitor the vital sign every hour. Option C. Assist the client to the bathroom to avoid. Option D. Turn the client on the side to check lochia. Vigorously massage the fundus. Option A is right answer. Question number 706. A nurse is caring for a prima gravida during labor. What does the nurse observe that indicate what is about to take place? Option A. Perineum begins to bulge with each contraction. Option B. Client becomes irritable and stop following instruction. Option C. Bloody discharge from vagina increases. Option D. Contraction occur more frequently, stronger and last longer. Perineum begins to bulge with each contraction. Option A is right answer. Question number 787. At what frequency the nurse should monitor fetal heart rate, uterine activity, and maternal vital sign in a high-risk woman during the first stage of labor? Option A, every 5 minutes. Option B, every 10 minutes. Option C, every 15 minutes. And option D, every 30 minutes. Every 15 minutes. Option C is right answer. Question number 708. When should the nurse transport multi-para patient from labor room to delivery room? Option A, when cervical dilation is 8 cm. Option B, when cervical dilation is 10 cm. Option C, when cervical dilation is 9 cm. And option D, when patient feels the urge to push. The right answer is option A, when cervix dilation is 8 cm. मल्टीपारामा 8 सेन्टिमिटर डाइलेट हुन्छ भने डेलिभरी रुममा शिफ्ट गर्नुपर्छ र प्रिमी ग्राभिडामा 10 सेन्टिमिटर डाइलेट हुन्छ त्यतिखेर चाहिँ शिफ्ट गर्नुपर्छ. क्वेशन नम्बर 709. What is a pregnant lady advised to do at a home when the complaints of a sudden gush of a watery fluid for vagina? Option A, go to the emergency immediately. Option B, ask her to use a sanitary napkin. Option C, advise her to wait for the fluid to stop. And option D, suggest that it's normal occurrence. Go to the emergency immediately. Option A is right answer. Question number 710. Vaginal examination and amniotomy during labor causes rise in a maternal plasma oxytocin level known as option A, Braxton Hicks contraction, option B, lightening, option C, Ferguson reflex, and option D, so. The Ferguson reflex is the name given to the neuroendocrine reflex initiated by pressure at the cervix or vaginal wall. The right answer is option C, Ferguson reflex. Question number 711. What reflex is an expulsive uterine contraction experienced by the mother during labor? Option A, pelvic reflex. Option B, urge reflex. Option C, Chadwick reflex. And option D, Ferguson reflex. Ferguson reflex. Option B is the right answer. Question number 712. A client is gravida 4, para 3 and is in a labor room. After a vaginal examination, it is determined that the presenting head is at station +3. The appropriate nursing action is option A, continue to observe client contraction. Option B, check fetal heart rate for a prolapsed cord. Option C, prepare to move the client quickly to the delivery room. And option D, Check with the physicians to see if an oxytocin drip is warranted. स्टेसन +3 छ द्याट मिन्स छिटै चाहिँ डेलिभरी रुममा शिफ्ट गर्नुपर्छ इट्स द टाइम अफ डेलिभरी ऑप्शन सी इज राइट आन्सर क्वेश्चन नंबर 713 during labor the nurse should monitor uterine contraction by doing which one of the following option A observe the client facial expression option B instruct the client to take a note of the duration of the contraction option C offer eye chips to the woman option D spread the fingers lightly over the fundus to monitor contraction फन्डसमा फिङ्गर राखेर चाहिँ कन्ट्राक्सन काउन्ट गर्नुपर्छ अप्सन डी इज राइट आन्सर क्वेश्चन नम्बर 714 A woman has been pushing effectively for 1 hour. A nurse would need at this time is to option A change position frequently option B ambulate option C consume oral food and fluid option C rest between contraction A nurse should need at this time is to encouraging rest between contraction. Option D is right answer. Contraction को बेलामा चाहिँ बल लगाउनुपर्छ र contraction छैन भने चाहिँ रेस्ट गर्नुपर्छ. Question number 715. Predictors for successful vaginal birth after previous vaginal delivery all are except. Option A spontaneous onset. Option B normal fetal weight, option C fetal distress, and option D cervical dilation more than 4 cm. Option C fetal distress. Question number 716. While performing a vaginal examinations for a woman who is in a labor process, you can feel a scapula of the fetus. What fetal presentation is expected in this case? Option A buttocks presentation, option B face presentation, option C shoulder presentation, and option D breast presentation. Shoulder presentation मा चाहिँ scapula fill हुन्छ. Option C is right answer. Question number 717. The first things the nurse should ensure when the baby head comes out is option A the cord is intact, option B no part of cord is around the baby neck, option C the cord is still attached to the placenta, and option D the cord is still pulsating. राइट आन्सर इज अप्सन डी फर्स्टमा चाहिँ हेर्नुपर्छ कि नेकमा चाहिँ कर्ड डाउन भएको छ कि छैन अप्सन बी इज राइट आन्सर क्वेसन नम्बर 718 when the lower pole of the uterus is grasped with the right hand and facing the woman head is known as option A pelvic palpation, option B combined grip, option C Paulic maneuver, and option D none of above. Right answer is option C Paulic maneuver. एक्जामिनेसन गर्दा चाहिँ obstetrical एक्जामिनेसन गर्दा अथवा एएमसी एक्जामिनेसन गर्दा 4 वटा चाहिँ म्यानुभर आउँछ यहाँ दिएको छ In obstetricians, the use of a 4-step in palpating the uterus in order to determine the lie, position, and presentations of the fetus called the obstetrical grip or lipoid maneuver. फर्स्टमा हुन्छ फन्टल ग्रिपमा चाहिँ फन्टसमा पाल्पेट गर्छ र आइडेन्टिफाई गर्छ फन्टलमा कि फिटलको हेड बटक के चाहिँ कुन प्रेजेन्टिङ पार्ट चाहिँ प्रेजेन्ट छ भने चाहिँ आइडेन्टिफाई गर्छ फन्टल ग्रिपलाई फर्स्ट लिपोइड म्यानुभर पनि भन्छ सेकेन्डमा हुन्छ लेटरल और अम्बिलिकल ग्रिप जसलाई चाहिँ सेकेन्ड लिपोइड म्यानुभर पनि भन्छ यसमा चाहिँ लेटरल पाल्पेसन गर्छ लेफ्ट साइड र राइट साइडमा चाहिँ कुन पार्ट प्रेजेन्ट छ एक्सट्रिमिटिज छ फिटसको कि चाहिँ यहाँ भटेब्रा छ कुन पार्ट छ भने चाहिँ आइडेन्टिफाई गर्छ लेटरल पाल्पेसनबाट। त्यसपछि पाउलिक ग्रिप र पेल्भिक ग्रिप हुन्छ। यसलाई थर्ड लिपोइड म्यानुभर पनि भन्छ। यसमा चाहिँ एक्जामिनर सुड फेस टुवार्ड द मदर फेस र ह्यान्डले चाहिँ त्यहाँ हलाउँछ इन्गेजमेन्ट भएको छ कि छैन र यसमा पनि इन्गेजमेन्ट पनि थाहा लाग्छ र बेबीको चाहिँ ब्लोटिङ भइराखेको छ कि छैन त्यो पनि आइडेन्टिफाई हुन्छ। अर्को पेल्भिक ग्रिप फर्स्ट हुन्छ, फोर्थ लिपोइड म्यानुभर भन्छ। त्यसमा चाहिँ एक्जामिनर सुड फेस टुवार्ड द मदर फिट to identify the pole of the uterus in the pelvis, that is the engagement भएको छ कि छैन त्यो चाहिँ आइडेन्टिफाई हुन्छ। सो यो चारवटा हुन्छ, फन्डल ग्रिप, लेटरल, पाउलिक ग्रिप एन्ड पेल्भिक ग्रिप। धेरै नै इम्पोर्टेन्ट छ यो। क्वेसन नम्बर 719, to determine fetal position using lipoid maneuver, the first maneuver is to option A, determine degree of molding, option B, determine the position of fetus, option C, determine what part of fetus is in a fundus, and option D, locate the back, arm and leg. फर्स्ट भनेको फन्डल ग्रिप। यसमा फर्स्ट लिपोइड म्यानुभरमा डिटरमाइन गर्छ which part of the fetus is present in fundus, हैन। ऑप्शन सी इज राइट आंसर। क्वेश्चन नंबर 720, what is the purpose of doing fourth maneuver? Option A, to know fetal part at the fundus. Option B, to assess the degree of flexion or attitude. Option C, to have an idea about the fetal part. And option D, to know if engagement occurred or not. To know if engagement occurred or not, यो चाहिँ फोर्थ म्यानुभरमा गर्छ। ऑप्शन डी इज राइट आंसर। क्वेश्चन नंबर 721, which abdominal grip is used to assess the descent of a head in a pregnant woman? Option A, fundal, option B, lateral, option C, pelvic first, and option D, pelvic second. थर्ड लिपोइड म्यानुभरलाई पेल्भिक सेकेन्ड भन्छ र फोर्थ लिपोइड म्यानुभरलाई फर्स्ट भन्छ। सो एसेस द डिसेन्ट अफ द हेड इन अ प्रेग्नेन्ट वुमन, यो कुनमा हुन्छ? पेल्भिक फर्स्टमा हुन्छ। ऑप्शन सी इज राइट आन्सर, द्याट इज फोर्थ लिपोइड म्यानुभर एन्गेजमेन्टको लागि र डिसेन्ट। क्वेसन नम्बर 723, following are the method of indications of labor except option A, artificial rupture of membrane, option B, methargine, option C, oxytocin, and option D, prostaglandin. methargine चाहिँ दिदैन inductions of labor को लागि। So right answer option B. Question number 724, the contraindications of an induction of labor include the following except option A, placenta previa, option B, fetal macrosomia, option C, cord presentation, and option D, CPD. Fetal macrosomia is not the contraindications of induction of labor. Option B is right answer. Question number 725, the following are the contraindications of induction of labor except option A, premature rupture of membrane, option B, placenta previa, option C, cephalic disproportion, and option D, cord prolapse. Premature rupture of membrane is not contraindication of induction of labor. Option A is right answer. Other question in other video. Thank you so much.